Anatomy key points for INICET November 2025 or NEET PG 2026. Costovertebral and costotransverse joints are synovial joints. Adductor pollicis muscle is supplied by ulnar nerve, which is used for neuromuscular blockade monitoring. Rugoscopy is the study of rugae of hard palate. The triangle of doom boundaries are very important. Medially bounded by vas deferens, laterally by gonadal vessels, apex at the deep inguinal ring. The right cardiac border is formed by superior vena cava, right atrium, and inferior vena cava. Straight branch of MCA, middle cerebral artery, Charcot's artery. The unlocking of knee is caused by popliteus, and locking of the knee is caused by vastus medialis. So these key points are extracted from PYQs and the GTs, 115 GTs. To get complete book PDF, WhatsApp on 87081872200. The muscle involved in swimming is latissimus dorsi. Then sternocostal surface of heart is formed by right atrium and right ventricle. The posterior tibial artery is located behind the medial malleolus, 2.5 cm, and the Achilles tendon. The openings in diaphragm is very important. The T8 opening is inferior vena cava. T10 opening is esophagus or vagus nerve also goes through this. Then T12 opening is aorta, aortic opening, and thoracic duct and azygos vein also goes through it. Foramen ovale transmits the accessory meningeal artery. Foramen spinosum transmits the middle meningeal artery. Then anterior cerebral artery is a branch of internal carotid artery. So these are the key points of anatomy, which is often asked, and there are many such points. So 115 GTs and every 20,000 plus points are available in the book. To get the complete book PDF, WhatsApp on 87081872200. And it contains 115 GT review, which includes PYQs of INICET and NEET PG. Okay, so and 10 key points or the clinchers, which are often asked, by which you can identify the correct option. Okay, physiology key points of INICET November 2025 or NEET PG 26. So inverse stretch reflex is Golgi tendon reflex, which is disynaptic. The lateral superior olivary nucleus is responsible for detecting the direction of sound. Cerebral blood flow is majorly regulated by BP. Then H plus ions are responsible for sour taste. Serotonin is secreted by raphe magnus nucleus. Then GLUT1 is present in RBCs, GLUT4 in skeletal muscles, GLT2 in renal tubule. Resting potentials of neuron or muscle are 70 millivolts, skeletal or hard muscle minus 90 millivolts, smooth muscle minus 22 to minus 65 millivolt, calcium plus 130 millivolt, magnesium plus 9 millivolt. Gastrocolic reflexes when the stomach distension by the food triggers the colon evacuation. Okay, then if you want to get complete book PDF of the key point, WhatsApp on 87081872200, and it is taken from 115 GT's reviews, which include INICET and PYQs and NEET PG GTs and PYQs review. More than 20,000 key points included in the book. Biochemistry key points for INICET November 2025 or NEET PG 26. In celiac disease, IgA anti-TTC is found. Nerve growth factor alpha has trypsin-like activity. Beta has nerve growth promoting activity. Gamma nerve growth factor has serine protease activity. N-acetyl aspartate peak is seen in Canavan disease, and aspartosylase deficiency is seen in this disease. Cofactor for lysyl oxidase is a copper. Urea and Krebs cycle linked by fumarate. Carnitine require vitamin C. RDA principle not applicable for energy. Then I-125 albumin used to measure plasma volume, inulin for the ECF, Evansby for plasma volume. Hartnup disorder, there is loss of tryptophan in urine, there is neutral amino acid urea, treatment is niacin. In hereditary fructose intolerance, there is deficiency of aldolase B, there is black urine on standing. Then it is alkaptonuria, homogenetic acid oxidase defect found. In folate trap, there is accumulation of methyl tetrahydrofolate. In succinyl acetone, boiled cabbage odor is seen. In tyrosinemia type 1, deficiency of humoral acetate hydrolase is seen. Then rate limiting enzymes are glycolysis, PFK1, glyconeogenesis, fructose 1,6-bisphosphatase. So likewise, I have given all the rate limiting enzymes in this book, so all key points are given. So I have extracted these points for PYQs and 115 grand test of marrow. And to get the complete PDF book PDF, of this key point, WhatsApp on 87081872000. So there are many more rate limiting enzyme which are directly asked. Then in MODI there is defect in glucokinase which is managed by dietary modification. In homocystinuria give pyridoxine supplements. In insulin it decreases the hormone sensitive lipase activity and increases the lipoprotein lipase activity. Get the complete book PDF WhatsApp on this number. Pathology key points for INICET November 25 and NEET PG 26. So perivascular atrophy found in dermatomyositis. In cancer, there is upregulation of muscle-specific ubiquitin ligase. If there are deposits of all IgA, IgG, IgM, and C3, then it is known as full house effect, seen in lupus nephritis. If there are walled clusters of epithelial cells, then it is meningioma. Dural tail sign also seen. Then to outer giant cell seen in xanthoma, achondroplasia associated with macrocephaly. If you see intrinsic hand muscle affected frontal baldness, then myotonic dystrophy is the answer. Then in fibromyalgia, there is tender bony prominence, increased pain sensitivity, glomus tumor pulsate vigorously and then blanches. Dalen-Fook nodule is a type for hypersensitivity reaction found in sympathetic ophthalmitis. In osteogenesis imperfecta, type 1 collagen defect is seen. In osteochondritis is most commonly associated with congenital syphilis. Ankylosing spondylitis, there is loss of normal lumbar lordosis. In osteosarcoma, the presentation will be ill-defined permeative bone lesion with cortical destruction. So all these points are taken from 115 GT review book, in which I have reviewed the GTs, 115 GTs including PYQs of INICET and NEET PG. You can get complete book PDF by WhatsApp on 87081872000. इस नंबर पे WhatsApp कर दीजिए, आपको बुक का PDF मिल जाएगा. बुक हैज़ 1800 पेजेस और इसमें 20,000 प्लस की पॉइंट्स हैं विच विल बूस्ट योर स्कोर इन INICET और NEET PG स्कोर. Pharmacology key points for INICET November 25 or NEET PG 26. So venlafaxine is used in stress urinary incontinence treatment. Cetirizine act by inverse agonist at H1 receptor. Lithium toxicity aggravated by occurs with thiazide, ACE inhibitor, ARBs, indomethacin, doxycycline and furosemide. Digoxin toxicity aggravated by hypokalemia, hypercalcemia, hypernatremia and hypermagnesemia. Okay, then these points are taken from 115 GT review book. To get the complete book PDF, WhatsApp on 87081872000. Then digoxin toxicity on ECG, sagging acid depression, Salvador daily sign seen. Tretinoin is used in acute promyelocytic leukemia, mania neurotransmitter are serotonin, norepinephrine, dopamine. If person with body packing with drugs, treatment is whole bowel irrigation. Then L-carnitine used in valproate toxicity. The diazoxide octreotide used in insulinoma. Cilastatin blocks the renal metabolism of imipenem. Okay. So these points are taken from 115 GT review book, in which I have reviewed 115 GTs and 1800 pages are there. So to get complete book PDF, WhatsApp on 87081872000. A rank booster book and which I personally followed. And microbiology key points for INICET November 25 or NEET PG 26. Alex test for diphtheria is Ochroluni procedure, double diffusion in 2 dimension. Microfilaria with tail free of nuclei is Eukarya bancrofti. Cryptococcus is acquired by inhalation of yeast cell from pigeon droppings. The culture method used to demonstrate oxygen requirements of the bacterium is tab culture. Positive lactulose breath test seen in small intestinal bacterial overgrowth. So these all points are taken from 115 GT review book, which include PYQs and GTs of INICET and NEET PG. And to get complete book PDF, WhatsApp on 87081872000. Then ground glass cornea, salmon patch, ghost vessel seen in syphilitic interstitial keratitis. Molar tooth colony seen in actinomyces. Fasciola hepatica egg is operculated. Schistosoma hematobium terminal has terminal spine. Schistosoma mansoni has lateral spine. Trichuria has barrel-shaped egg associated with rectal prolapse. Amoeboid form of Naegleria fowleri is infective stage. In Paracoccidioides, pilot will appearance is seen. So all these points are taken from 115 GT review book and 1800 pages it have and 20,000 such key points. and include PYQs of NEET PG and INICET. To get the complete book PDF of 1800 pages, WhatsApp on 87081872000. Forensic medicine key points for INICET November 25 or NEET PG 26. In Breslow second life test, stomach and intestine are tested. Pape's rule is applicable for blunt trauma to the skull and gunshots. IPC 197 deals with issuing false certificates. Section 85 IPC is responsible for criminal responsibility under forceful intoxication. Section 302 IPC is for murder. Adipose here is not seen in fetus less than 7 months of age. Rigor mortis appears from head to toe. Viscera preserved in poisoning case are stomach, small intestine, liver, gallbladder, kidney, blood and urine. So all these key points are taken from 115 GT review book. To get complete book, WhatsApp on 87081872000. Blowback phenomena is seen in head wounds. Then Gatler's test differentiate fresh water versus salt water drowning. In Rokitansky method of autopsy or in situ dissection used in HIV, hepatitis B and gonorrhea cases. Luke's abscess is the meatal abscess. Then Burns is blister with clear fluid seen in post-mortem burns, curling ulcer seen in ante-mortem burns, raindrop pigmentation seen in arsenic poisoning, arcing of the back seen in strychnine poisoning. So these key points are taken from 115 GT review book, in which I have included the review or key points of 115 GTs including PYQs of NEET PG and INICET. To get this complete book of 1800 pages, WhatsApp on 87081872000. Community medicine or PSM key points for INICET November 25, NEET PG 26. So Srivastav committee was gave village health guide scheme. Ujjwala Yojana is for cooking LPG safe fuel. Ujala scheme is for LED bulbs. Inspire strategies to prevent the violence against children. Bleaching powder dose calculation is by Horrocks separatus. Pasteurization efficiency tests are phosphatase test, coliform test, coliform count, standard plate count. Under Rashtriya Arogya Nidhi, 20 lakh financial support given for rare disease to BPL families. So these key points are taken from 115 GT review, in which I have reviewed 115 GTs and includes PYQs of INICET and NEET PG. To get book, WhatsApp on 87081872000. Asha visits are institutional delivery 6 visits, for home delivery 7 visits, for LSCS 5 visits. Under Lakshya scheme is for improving the quality of labor room and maternal OTs, infant mortality rate, literacy rate and life expectancy. These are indicators of PQLI. For immunization coverage studies, cluster sampling is used. Under motivation model of health education, medical motivation and social interventional model are there. National Deworming Days on February 10th and August 8th. World TB Days on March 24. World Health Days on April 7. So this book has 1800 pages. Such key points are given, 20,000 plus points, and 115 GTs are reviewed. It has all PYQs and GTs of INICET and NEET PG. To get the book PDF, WhatsApp on 87081872000.